Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're going to go over the $1,000,000 minute. So I think I'm on day like 18 of this EMR transition. It is getting a little bit better. Kind of the stress points for today were that. So now Morali, he works in a different building where I have to give him a whole hour lunch, which is kind of bad because he used to kind of work through the lunch and not get much of a lunch. It's probably better for him to get that time off. But what I've found is there's a buildup of notes kind of from the morning, and then he finishes them in the afternoon. And I found that there's a note section within the EMR where I can put in some shorthand. I can help him a little bit with the X-ray findings, and then I put in shorthand. It's almost like, and I'm almost thinking, I think they have a way you can dictate. I almost think if I could dictate, it would be a little bit easier. Almost the old way when you used to do transcription, but just have him do the things afterwards. I can tell him the details, and he can listen to them and kind of work in the background. The reason I like to have him live, though, is that he can put in my patient education information, and he can do orders. But I guess I could start doing that as well. I'm still trying to figure that out. But let's go through the day. So I was able to actually write everything down, so this is kind of a good thing. These were some things from the previous day. But the best thing that happened was there was a patient. We have this new online booking system. We never had this before because it didn't work out. But he came in, he had a foot infection, and he was able to make just a last-minute appointment. He was actually unsure if it would really work. As we are, but it ended up working, and he came in, and there'll probably be some bad things, maybe inappropriate patients making appointments in wrong slots, but for this guy, it made kind of all the difference to get his antibiotic and his infection kind of under control. So, patient, 64-year-old female with left ankle fusion and subtalar joint arthritis, and she has some peroneal tendonitis. She found us online. She had previously done shockwave with another doctor. This doctor, because of the subtalar joint arthritis, said, hey, this all is arthritis. And she said, no, this is peroneal tendonitis, which she did have as well. And we did shockwave number 1 of 6 on her. Next was a 68-year-old female for bilateral plantar fascial pain. Got a night splint. She didn't want the other night splint, so we just gave her one night splint. As well, we did. I think I did a orthotics or a cortisone injection for her, and she also had some nail fungus, and we switched it to diflucan. Next was a 57-year-old. She had tarsal tunnel, and we did NSAIDs, kind of cross-frictional massage, and then if it doesn't get better, we're going to consider doing a really light shockwave to that nerve in that region. Next was this is an 18-year-old. This was this pes anserinus thing, which I get a little concerned. I'm out of my scope because it's kind of higher up, but she, after 3 sessions of shockwave, she was totally better, and she's going to PT, and she's going to be getting her orthotics. I did lose some sleep over this one because I know it's kind of been considered the knee, but I think it's related to the foot, the soft tissue from the foot, from her pronation. But I'm having her follow up with PT. Next was a 31-year-old male, follow-up cantharidin. Since it was looking so much better, I did silinicaine on his, so another lesion destruction. Next was a 47-year-old. This is this guy that made the appointment. Left foot cellulitis, did antibiotics, x-rays, 2-week follow-up, and he found me online. Next was a 63-year-old male, number 2 out of 6 for shockwave, left heel pain, and kind of I talk a lot to my patients about kind of what's going on in their life, and this patient, his wife was developing some Parkinson's, so I kind of shared my dad had this dementia, and so it's a way of kind of connecting with patients. Next was a 76-year-old male, x-ray, 3 views bilateral. He got the nail fungus kit, possible gout. So I did an uric acid for him. Next was a 37-year-old female for left ankle pain, x-ray, ultrasound, and then did a cortisone injection into the ankle joint. Next was a 77-year-old female, plantar fascia. I did a right heel cortisone, x-ray, ultrasound, and she's going to follow up in 3 weeks. And I said, if it doesn't get better, we'll do shockwave. Next was an 82-year-old female, EPAT number 3 out of 6, to the anterior ankle. She also had a rash. So she has a really bad ankle joint arthritis. And so I'm doing the shockwave more for the bone marrow edema in there, And she also had a rash, so I did clobetazole for a rash around it. It was from rubbing on a previous AFO that she had. Next was a 63-year-old man, X-ray, ultrasound, and then a cortisone injection for plantar fasciitis. I'm doing a lot of cortisone these days. I don't usually do as many. Not sure if it's just because how acute the plantar fascial pain is, or if I am just too stressed with this new EMR to actually go through all the treatment options with patients. The next was a 44-year-old. She's a status post EPAT, and she's 100% better on her Achilles. She was really happy about doing the treatments. She did, I think it was 6 races within the last 3 months, and no pain whatsoever. So she would have been a good one to do a video testimonial for her. I asked her to write a review, though. The next was a 59-year-old male with left Achilles. Similar thing to this other one, but his was insertional, so we set up 6 shockwaves and the Pelto Special. If you don't remember what that is, that's a night splint, foam rolling, and morning stretch. And I recommended orthotics on the 3rd visit, or 3rd shockwave. Next was a 54-year-old who had number 3 out of 6 for peroneal tendonitis. Next was a 29-year-old for right 5th toe, pterygium, that little extra piece of nail, so I did a matrixectomy on that. Next was a 55-year-old female, number 2 out of 6 for plantar fascial pain, and we'll do orthotics at the 3rd. Next was a 33-year-old female, last shockwave, number 6 out of 6. Remember, for the last shockwaves, I always do an office visit, so I'm having to learn how to code that. So you have to do separate and identifiable within ModMed to get that office visit at the last shockwave. Next was a 37-year-old status post IND. Came back and had nail fungus, and I did the fungal nail kit for him. Next was a 48-year-old female status post shockwave, number 6 out of 6, doing better for her plantar fascia. So one thing I learned from a doctor that reached out to me, he said, Don, when you have a possible stress fracture, so sometimes I can't see these things on x-rays, like stress reaction, stress fracture, he recommended doing an ultrasound and billing for an ultrasound for that. I have not been doing that, but doing more of an ultrasound read. If you're unsure, if you can't see the line on the x-ray, you can do an ultrasound and do that. So it's something that I took away that I can do more ultrasound with. So just wanted to share that with you. So if you have any other tips, kind of based on what I'm talking or things that are working for you, please shoot me an email, don@podiatrypracticemastery.com. I would like to know how you practice, or how you practice differently or more profitably than I do, so we can all kind of get better together. Okay? Hope this was beneficial. Talk to you guys next time.